Question number 1. A patient with a head injury has a glaucoma scale score of 6. What does this indicate? The right answer is option C, severe head injury. Question number 2. In septic shock, which is the first priority intervention? The right answer is option A, administer 4 fluids. Question number 3. A patient with chronic kidney disease is on hemodialysis. Which electrolyte imbalance is most common? The right answer is option A, hyperkalemia. Question number 4. Which complication is most likely in a patient receiving long-term corticosteroid therapy? The right answer is option B, osteoporosis. Question number 5. Which assessment finding an early sign of increased intracranial pressure? The right answer is option C, restlessness and confusion. Question number 6. A patient with deep vein thrombosis is started on warfarin. Which lab value should be monitored regularly? The right answer is option D, prothrombin time and INR. Question number 7. A nurse is caring for a patient with heart failure. Which medication improves survival in patient with reduced ejection fraction? The right answer is option B, beta blockers. Question number 8. A patient with acute pancreatitis is experiencing severe pain. Which intervention is most appropriate? The right answer is option C, administer 4 opioids. Question number 9. A patient with chronic obstructive pulmonary disease is on home oxygen therapy. Which instruction is essential? The right answer is option C, avoid open flames while using oxygen. Question number 10. An aberrant patient with a severe fluid loss, which 4 fluid is prepared for resuscitation in the first 24 hours? The right answer is option B, Ringer's lactate. Question number 11. A patient on digoxin reports nausea and visual disturbance. What should be the nurse do first? The right answer is option C, hold the medication and notify the physician. Question number 12. Which drug is used as an antidote for opioid overdose? The right answer is option A, naloxone. Question number 13. Which medication is contraindicated in a patient with asthma? The right answer is option D, beta blockers. Question number 14. What is the most serious side effect of aminoglycoside antibiotics? The right answer is option B, nephrotoxicity. Question number 15. Which medication requires monitoring for lactic acidosis in diabetic patients? The right answer is option A, metformin. Question number 16. A patient on warfarin therapy should avoid excessive intake of which vitamin? The right answer is option C, vitamin K. Question number 17. A nurse is given morphine to a patient in pain. Which vital signs should be monitored closely? The right answer is option B, respiratory rate. Question number 18. Which insulin type has the fastest onset of action? The right answer is option C, lesproinsulin. Question number 19. What is the primary action of furosemide? The right answer is option D, diuresis. Question number 20. Which medication is most appropriate for treating anaphylaxis? The right answer is option B, epinephrine. Question number 21. A patient with myocardial infarction is given aspirin. What is its primary purpose? The right answer is option C, blood thinning. Question number 22. Which ECG change is most indicative of myocardial infarction? The right answer is option B, ST segment elevation. Question number 23. What is the preferred site for central venous catheter placement? The right answer is option B, subclavian vein. Question number 24. A patient in shock has a mean arterial pressure of 50 mmHg. What is the first action? The right answer is option A, start for fluid. Question number 25. Which medication is used for rapid sequence intubation? The right answer is option A, succinylcholine. Question number 26. What is the normal intracranial pressure ICP range? The right answer is option B, 5 to 15 mmHg. Question number 27. Which electrolyte imbalance is most common in diabetic ketoacidosis? The right answer is option B, hyperkalemia. Question number 28. Which condition requires immediate defibrillation? The right answer is option C, ventricular fibrillation. Question number 29. What is the primary purpose of PEEP, positive end expiratory pressure, in mechanical ventilation? The right answer is option B, prevent alveolar collapse. Question number 30. What is the best indicator of adequate perfusion in shock patient? The right answer is option D, urine output. Question number 31. A patient with a spinal cord injury at C4 is at risk for which life-threatening condition? The right answer is option A, autonomic dysreflexia. Question number 32. Which assessment finding suggests cardiac tamponade? The right answer is option B, Backstreet. Question number 33. A nurse is administering Mannatol for increased ICP. Which parameter should be monitored closely? The right answer is option C, urine output. Question number 34. Which intervention is most critical for a patient with status asthmaticus? The right answer is option D, give nebulized bronchodilators. Question number 35. A patient with Addison's disease is experiencing adenosine crisis. What is the first treatment? The right answer is option A, for fluid and corticosteroids. Question number 36. A patient with hyperthyroidism is at risk for thyroid storm. Which symptom is most concerning? The right answer is option B, tachycardia and fever. Question number 37. A patient is in diabetic ketoacidosis. What is the first treatment? The right answer is option B, 4 fluids. Question number 38. Which condition is associated with chiastic and resource signs? The right answer is option C, hypocalcemia. Question number 39. A patient with septic shock has a serum lactate level of 5.2 millimole per liter. What does this indicate? The right answer is option C, severe tissue hypoxia. Question number 40. Which laboratory value is the best indicator of renal function? The right answer is option C, serum creatinine.